Aloha. Good morning, everyone. Welcome. Thank you for joining us. We are the Healthcare Insider. I am Tish Lopez, your moderator this morning. Thank you so much for joining us on this beautiful Aloha Friday. Before we get started, we want to let you know that today's Zoom meeting is being recorded so that you and others may access it in the future. All of our presentations are available on our YouTube channel simply by searching Hawaii Care Choices. We have some exciting new things happening here today, and I'd like to introduce you to Lani Weigert, Community Relations Manager for Hawaii Care Choices. Aloha, Lani.
Aloha, Tish. Thank you, everyone, for joining us. We have such an awesome agenda for you today, and we're really looking forward to unpacking all of it for you. But first up, we have our own hometown doc, Lieutenant Josh Green. Our Lieutenant Governor is joining us today, and I did see you on the news earlier this morning, so I know that we are part of a very long Zoom marathon for you, Lieutenant Governor, and I'm just so happy that we have you here for this moment. So anyway, I just would like to jump in on the questions that we've already been receiving. And one of the first questions is, with all of the different level mandates that have come in just the last 24 hours, from the president, we have the governor, we also have the mayor from Oahu and Maui as well. In your opinion, what kind of impact will that have with regard to getting a handle on this pandemic? Oh, I see that you're still muted. Tish, are you able to unmute
Forgive
him?
me. There we go. Does that sound okay?
That is. Thank you so much.
I was just saying I feel very honored to be on the show, so thank you for that. The impact of the vaccine mandates will be that about a third of the individuals who are still holding out will likely get vaccinated. Some of those individuals have been waiting for the FDA and the CDC to authorize fully the vaccinations. That happened on the 4th of this month. Others have kind of held out because they didn't have to get vaccinated for work or for their contract work. It will not be everyone. Let me give you a few statistics. 86.4% of all of those who are eligible to be vaccinated in our state of Hawaii have at least initiated the vaccine. So only 13.6% have chosen not to, who are eligible. The reason I talk about that number is because there are children under the age of 12, like my son Sam, who of course cannot yet choose to be vaccinated because it has not been approved. So in some states, those numbers of those who are eligible to get vaccinated are very low, 50%, 45%, 53%. They don't have a big impact there, but mandates are not going to have as large an impact in Hawaii. They will have some impact. I would also say this, just me as an individual or as a lieutenant governor also and doctor, I do think that when we ask people to get vaccinated and we insist on it, if they have a strong philosophical opposition, we should also at least give them the option to test frequently. And I think that's probably the fair compromise. I, of course, am very in favor of vaccinations and supported it for myself, for my wife, for my daughter, who's 14. But I wanted to be clear about that. We have 175,242 individuals right now in our state who have not yet chosen to be vaccinated, though they could be. And I would say about a third of them, like I said earlier, probably will be because of these orders from the governor or the president.
Thank you so much. And speaking on the line of vaccine hesitancy, one of our viewers had some comments and just wanted to know what your opinion was on some of the advertising that comes on the television regarding vaccines. So the viewer had was that they often show people receiving a very long needle going into their arm, or that when deaths are reported, it's often reported that the person had underlying conditions, and it's often not shared what those conditions are. So people are thinking maybe these are the side effects of those who did receive a vaccine. So can you share with us your opinions about how this information is unfolding for the general public?
Sure. Okay. So first of all, regarding just being vaccinated, the needle is quite small, and I don't want people to worry about it. It's the gauge of the needle or the size of the tip of the needle that tends to be what's most impactful. So I want people to not worry about that. It's actually a pretty gentle vaccination as compared to many, just so people know. I've given thousands of them now and had them myself. So don't worry about the needle. Now, the underlying conditions have nothing to do with the vaccination itself. The underlying conditions have to do with what people had before they were vaccinated, before we even had the pandemic. A large number of people in our society have underlying health problems like prediabetes, renal disease, that's kidneys. About 1 out of 7 people in Hawaii have some form of kidney disease. Also, a lot of people have high blood pressure. And then there are other challenges like anxiety, depression, and mental illness is very prominent, especially now during the pandemic. So large numbers, as much as 40% of people have some significant underlying condition. If you catch COVID and you have heart or lung conditions particularly, or are very heavy, have a very high body mass index, meaning quite super chubby, okay? I'm chubby, but I mean super chubby, okay? If you're very big, then you have a much higher risk of dying of COVID. And so those are the underlying conditions people should be worried about. So if I can kind of boil it down, if you have those underlying health conditions, it's even more valuable to get vaccinated, because if you have those underlying conditions, like you're very heavy or you have lung problems or heart problems, and you catch COVID, it's a lot more likely that you'll end up in the hospital, maybe need a ventilator or die from COVID. And so the New York Times printed up a story today that said that people who are unvaccinated have an 11 times higher likelihood of dying. 11 times, that's 1,100% versus if you have had a vaccine. Now, the vaccines aren't perfect. They will not always stop COVID, but they will almost always stop severe hospitalization or deaths. The last number I had out of the 600 plus deaths was that only about 8 of them had been people who were fully vaccinated. Now, that number might have gone up a little bit, but it's a very low number, meaning that most of the people that have passed away from COVID have been unvaccinated. So that's the real message for me as your doctor.
Thank you so much. We've noticed that there are pre-hospital tents being set up outside of hospitals for people to have some type of treatment, intravenous treatment or something. Is that something that will be coming to the Big Island as well?
Yes, it will. We'll have 2 sites, I believe, for monoclonal antibody care. And let me describe what monoclonal antibodies are. Also, people use the word Regeneron, which is the company that's producing most of them. Monoclonal antibodies are what you would get if your body was able to actually elicit an immune response to COVID. You would create antibodies, like if you've been vaccinated, you create antibodies, then you can fight it. The monoclonal antibodies are like what our former president or the governor of Texas and many other people have had. They are giving you a direct treatment against the COVID virus. They work, they decrease by 70%, 70%, the likelihood that someone will get very sick or die. But it's only a very specific group that can take monoclonal antibodies. Usually it's for people who have had an immediate bad exposure to someone who's got active COVID, and if you are unvaccinated. For vaccinated individuals, we're not using monoclonal antibodies because you're already creating these antibodies in your body. If you're in the hospital, the doctors in the hospital, like myself, will decide what you need additionally. But it's mostly meant for people who have mild to moderate disease, who were not vaccinated, but caught COVID. And now, before they get severely ill, they get 1 dose. It's either intravenous through a full IV or subcutaneous, which is shots underneath the skin to prevent the worsening of the symptoms. And I believe they're going to be doing them at Hilo Hospital in Kona. I think they're going to have at least 2 sites, and we're going to have 12 sites at least across the state. I think they're already activated. Plus, some of the community health centers are doing the work. It is something that is it's good treatment, but the vaccination is by far the better way to go in advance, because you would be better off to prevent even getting any symptoms whatsoever. And that's what the vaccine is meant to do.
Is this therapy being used on children who are catching COVID that are below 12?
No, actually, thank you for asking. It's just for 12 and older. And
Oh,
so children are not. And let me talk a little bit about children. So we've had 135 children as of yesterday hospitalized over the 18 months for COVID. We've had one fatality from a child that traveled from the mainland to Hawaii that had very serious underlying health conditions, and that was tragic. But to my knowledge, no other children have passed away from COVID. We've tended to have one or two children in the intensive care unit, the pediatric intensive care unit, at any given time, whereas we've usually had between 80 and 90 adults in the intensive care units. And children tend to have symptoms for far less time. Only 4% of children are having symptoms after 30 days from COVID, whereas 30% of all adults are having symptoms after 30 days if they've had COVID. So children are doing better, but we still don't want to see spread. And I know that that's a concern. My child goes to public school, my 10-year-old, and his class had to lock down because of outbreaks of cases in his classroom, and he had to do isolation at our house. So I'm very aware of the impact of COVID on our schools. The alternate argument is 1,000 children in our state that are in public school. They need education, they need to have their developmental milestones met, and they need nutrition, many of these children. And so far, about 2,000 children have had COVID in school, whether they've caught it there or outside, we don't know exactly. But it's a great challenge, and I won't fault any parent who decides to do distance learning. But I will say that Jamie and I decided to keep our kid in school because he needs it. He really needs school.
Thank you. There's been discussion that Ocean View on our island doesn't seem to be getting their vaccinations. I know that you work out on that end of the island quite a bit. What's your thought about it? Do you think it's lack of access, or what seems to be the problem out there in Ocean View?
Well, it's always, I was a doctor there for many years in Ka'u and Ocean View, in that district, that part of our beautiful island. And there's always been a reluctance to get vaccinated in higher numbers. Not everyone, of course, but we've always had many more people as a percentage not want to be vaccinated if they lived in Ka'u. Some of it is cultural, because there are some parts of our community that are a little bit more culturally sensitive about being vaccinated, so they didn't do it. The Hawaiian community and the Filipino community, at times, in some cases, chose fewer vaccinations. Not always, but that does happen. And so these are realities for Ocean View. Access-wise, yeah, I mean, we are in Ocean View further away from everything. However, it's been almost a year now where people could drive into town and stop by any of the pharmacies or the hospital or numbers of places to get vaccinated. So that's really not it. It's mostly people just being reluctant. And unfortunately, in our rural communities, in Ocean View, Ka'u in general, in Hana, and in West Oahu, in Waianae, these are rural communities. They've had a lot more cases, and they've had far fewer people get vaccinated.
Tish, I'd like to hand it over to you. You can go ahead and ask all the other questions that are coming in as well.
All right, sounds good, Lonnie. Thank you so much. Thank you so much, Lieutenant Governor. We do have a lot of people that really want to know, what's today's update on the state's infection rate?
So the infection rate today our positivity rate is 7.01%. And that positivity rate has been dropping. I will tell you, for instance, if we look back on just a couple dates, like the 19th of August, back about 3 weeks, it was 7.62%. And it had peaked at about 8.5% in our state. So it's coming down. Of course, it was much lower before the 4th of July. If you look back on July 4th, our positivity rate was only 1.64%. So gatherings on July 4th set this off. And that's why I was so serious about Labor Day, and why we're still kind of on the COVID tsunami watch from Labor Day, because any gatherings, especially if parts of the community are unvaccinated, will create large bursts of COVID. It's just not worth it, because people get sick and sometimes die, but also the COVID cases then persist for several months. And so large gatherings are by far our greatest danger, especially in areas where there aren't vaccinated folks. A lot of people are worried about the travel related cases, and I worry too. I mean, I'm actually the one who wrote the program and built the Safe Travels program. But only 1 to 2% of all of our cases of COVID have come from visitors. The rest of them have been our own people coming back, and we're then back with our families. And if people are traveling unvaccinated, they then go home, spread it to their loved ones or to their buddies, and then it spreads to the community. That's what really happens. And so that's what I wanted to share. Today's count is 747, which I don't love, but the positivity rate has been trending down, and the 7-day average is at 606 cases a day. It got as high as 800 cases a day at one point last week, which was terrible. So our 7-day average peaked at 874. So we are now on the downside a little bit. And if we get a little bit lucky from the Labor Day weekend, we'll continue to see the numbers drop. But I will share this. I just have these numbers kind of hot off of the press here. In the last 30 days, we've had 96 fatalities statewide. Keeping in mind, we have the lowest fatality rate in the country. 96 fatalities in the last 30 days. 30 days before that, we only had 22 deaths because we had far fewer cases and fewer hospitalizations. So everyone should be very careful because we need to keep these cases down in order to stop anyone losing their life.
Wow.
Thank you so much for all of that information. Lieutenant Governor, after 18 months or more, really more, of dealing with this pandemic, in your opinion, what should the goal be? Especially since we can't control the actions of others, like you were saying, what actions can we take to deal with this COVID fatigue?
Well, we're going to approach 90% of our eligible people being vaccinated. And at 90%, I think you're going to have to call it a victory. No other state will probably reach that number. There will always be about 10% of our population or any population that will resist. At that point, I think we will see a deep drop in the numbers and we should return life to normal, but be mindful in areas and parts of our community that have much lower vaccination rates that there will be some outbreaks and we'll have to be supportive. But schools should go back more or less to normal at that point. Whatever children who can't be vaccinated throughout this winter probably should still wear masks in school, and we should just be mindful of some of the basics. But I'd say in the new calendar year, we'll be pretty much normal. And I can't guarantee that just yet, but the probabilities are there. And beyond that, we will, of course, see a big boom in our economy. People want to come to Hawaii. It is, whether people want to believe it or not, the safest state in the country, with maybe the single exceptions of like Vermont or Maine, which are very rural and very few people go to compared to Hawaii. So we are the safest, we're healthy, we're the healthiest state in the country based on all the other indicators. So we should prepare for that. We should prepare to emerge from the pandemic as a stronger family, a stronger community, because we did, in spite of reports of protests here or there and arguments, in spite of all those things, we are the most cohesive state with some of the best results. And so I think we emerged stronger, though it's been an extremely tough year. And this is not about me, but maybe me more than anyone will be relieved that we began to emerge from the COVID pandemic, because I have folders now that are this thick from the day-to-day response every day, looking at the numbers, looking at the deaths, looking at the positivity rate and all the other data. And I'm looking forward to focusing on other things that we need to focus on, like our kids' education, like homelessness, like our economy. So I think we can look forward to 2022 being a very good year for our families.
That is very hopeful to look forward, and it's something exciting to look forward to as well, essentially going back to normal. Thank you so much for everyone giving in their questions. We have so much more to ask, but I only have time for one more question. Lieutenant Governor, as our last question, how would you like to see Hawaii's healthcare system evolve in the future?
I appreciate that. It's a very thoughtful question. I would like to see us have more ability to communicate to all of our people in real time. I think that is one puka that we had in our system that would have made a very big difference to prevent spread in cases. So, as I contemplate becoming a candidate for governor and perhaps the choice of people, I will be working on definitely technological advances and communications for all of our people. We also do need to further incent nurses and doctors to come to our state. if we invest $5 to $10 million a year in loan repayment, which is matched by the federal government, we shouldn't have any shortages in the future for healthcare providers. As you know, I was the health corps doctor for KAU of the Big Island, on the Big Island for 4 years. And I was on call last weekend in the hospital up in Hawaii. I'm still on call on the weekends, but we could easily deal with that healthcare shortage if we use a little bit more political will. So those are some of the things that we should do. In addition to that, we have shown that our healthcare system is resilient enough to deal with the pandemic. I spoke last week about reaching 500 and seeing the healthcare system perhaps crumble under the pressure. Well, we're lucky enough that our number has dropped from a peak of 448 people in the hospital to 409. But we did press right up against that limit. And so I was proud of our team that they were ready to be nimble enough to set up field hospitals, but I hope we never have to do something like that. That is really scary stuff. So I'm putting in contingency plans on top of contingency plans to keep our people safe, no matter what happens in the future. But in the meanwhile, some modest technology would help us a lot to prevent some of these surges and other challenges. So I appreciate that question. Not many people ask that question. And there are some things, in spite of being one of the best healthcare states in the country, we can still do a little better.
Well, thank you so much. I appreciate that. Again, I'm so sorry to everyone. We will not be able to get to the rest of the questions today. Lieutenant Governor, I know you have a busy day, has been a busy day already and a busy day ahead of you, but I just want to thank you so much for joining us this morning on our Healthcare Insider.
If people need me, I appreciate that. You guys can always get me on my social media, which is, I think, at LTGov Josh Green. So we'll give those updates all the time, every day for people. And I hope that helps. But thank you all for welcoming me.
Awesome. Mahalo again. Go. Thank you. Thank you so much.
Take care. You bet.
Thank you. Aloha. All right. Thank you so much for all of those who are still with us. That was just so much information and updates for this Aloha Friday. Gosh, Lonnie, that was a lot.
Yeah. So for everyone that's joining us, I mean, the Lieutenant Governor, he has been just blazing across the state for us and really trying to communicate a lot of this information. I mean, the fact that he even allows us access to him is really humbling on our side, that we're able to get him and ask him these questions. And we wish that we could have asked everybody's question, but anybody's question that we have, I'll still send it to him, and we'll see if we can get those answers to him. He's actually been online over different Zooms today since 5 a.m. And so he's actually signing on to one at 10:25. So we had a real hard stop on that one as well. Oh, okay, let me see. There's something.
Yes, we did. And I do not envy him, but he is doing a wonderful job. I agree, Joyce. He does give us hope and comfort. He is such a wonderful man and very knowledgeable as well. All right. So moving on our wonderful Healthcare Insider. For those of you joining us on Zoom webinar, I would just like to give you a short slide. The bottom of your screen should look like this. Many of you are so fabulous, already sending us chats and questions and answers. So go ahead and still use that chat box. Say aloha to Lani or anybody that you see inside this webinar that you know. Feel free to tell them hi. And also the Q&A box for any questions that you have for Lani. We do have a little bit more time with Lani, so hopefully she can get to your questions as well. Healthcare Insider is now an interactive presentation, so we'll be asking you questions throughout the presentation as well. So use that raise your hand button to send us feedback, and we will go to the Facebook Live participants. Thank you so much for joining us. Those of you on Facebook, aloha. Please use the comment box to say aloha to us as well and chat in questions, which you already have been doing. Thank you so very much. We will be asking you questions throughout the presentation too. So use that love heart or thumbs up or even the care button. Again, Healthcare Insider is an interactive presentation and we want to see those emojis pop up. We are also doing polls today. For those of you watching on Facebook Live, you'll not be able to see the polls pop up, but we do want to hear from you. So again, put those answers right in that comment box. Everyone is welcome to join in the Fully Engaged Zoom presentation next month. You can just email me at llopez@hawaiicarechoices.org and I'll send you the link. So polling is very simple. As you see up here, a question will pop up on your screen. Please make the selection that you think is best and submit your poll on the bottom. Just to kick things off and get everybody a little bit more comfortable, get a little of that coffee flowing, we're gonna go ahead and launch an icebreaker. So that question should be on your screen now. If you could be any one of these mythical animals, which one would you be? A dragon, a unicorn, a mermaid, or a sphinx? Again, just to reiterate, those of you following us on Facebook Live, you'll not be able to engage in the polls, but please give us your answers right there. What kind of mythical creature would you be? A dragon, unicorn, mermaid, or sphinx? Because I am watching those questions come in. All right, I'm gonna go ahead and end the poll there and share our results. 22% of you said they would like to be a dragon, 35% of you said unicorn, 39% would like to be mermaids, and 4% would like to be sphinx. So I'm going to go ahead and stop sharing right there. And you all did so wonderful. Thank you so much for joining into our polls. We are going to be bringing that up during our presentation as well. But it was so easy. I know you guys are so smart. Now I'd like to hand over the microphone to Lonnie, again, our community relations manager.
Thank you so much, Tish. That was such a fun poll. Oh my gosh. And I'm glad that, you know, even for us technologically challenged, we're able to participate. So that was really fun. Thank you so much. So now I'm going to let everybody know that we're going to focus on the presentation, and you'll still be able to put in your questions or comments in the chat, but we're gonna minimize our video blocks here so that we don't cover a portion of your viewing screen. And although you'll be able to hear us, we'll also be able to see your chats, etc. And at any time, Tish will go ahead and weigh in if she sees something that's coming through that we can bring up. But we're just letting you know we haven't left the room. We're just minimizing the view so that you can have a better view of the screen. So that is what we are going to do at this time. Okay, great. So on here, I just wanted to share the different programs that I'm gonna talk about are the palliative care and the hospice care programs. And as you see here on the screen, what the highlights are of each program. So if you haven't heard about palliative care, you soon will. And for many of you that have joined us from the very beginning, we've been doing presentations for over a year now. So we've been trying to figure out different ways to share the information so it's very understandable. Palliative care, it's a special type of care that has gained a lot of attention in the last 6 to 7 years. Palliative care eases, it alleviates, it relieves and soothes pain and discomfort from treatments such as radiation, chemotherapy, dialysis, and surgery due to serious illnesses such as cancer, kidney failure, COPD, or even congestive heart failure. So hospice is a subset of palliative care. So that palliative care umbrella is quite large. Hospice care focuses on the comfort from pain and suffering experienced from the natural progression of these serious illnesses as a person approaches end of life.
So ladies and gentlemen, if you understand that palliative care focuses on relief and hospice care focuses on comfort, give me a thumbs up or raise your hand.
Yay, that was fun. All right, you guys are getting it. You guys are getting, thank you so much for using your buttons on the bottom. This is so great. You guys got this. You definitely got this. Okay, so how is palliative and hospice care the same? So I noted it right here on your screen. A lot of people are thinking it's the same, but actually there is a difference. These, however, are the reasons that it's quite similar. So we actually outgrew our name, in fact, when we added palliative care. So we were known as Hospice of Hilo at one time. And then once we offered Kupu Palliative Care over 6 years ago, that's when we decided to change our name to Hawaii Care Choices to really honor where we live, which is Hawaii, that care will always be at the center of everything that we do, and that we offer choices to our community. That is truly the gift to our community, is to let them know that, you know, they don't just call us and automatically go into hospice care. They have choices and could in fact be going into palliative care as well. And now we see that palliative care has grown in such popularity that oftentimes we have almost as much palliative care patients in our programs as we do hospice.
All right, friends, raise your hand if you think palliative and hospice care improves quality of life for patients and their families.
Awesome. Great job, everyone. That's so good. We love watching your response. So how are they different? How is palliative and hospice care different? Palliative care does not require a 6-month prognosis or prediction by a doctor to qualify for care. Many in palliative care are still leading active lives, traveling, going to sporting events, graduations, and they often live months, if not years. Yet, they are all living with different stages of very serious illnesses, such as cancer, COPD, congestive heart failure, or kidney failure. So patients of any age can receive hospice care as well as palliative care. Many people didn't know that. However, on hospice, the person has to have a terminal illness with a 6-month life expectancy. So, you know, the prediction from the doctor would need to be at least 6 months. There are many people who live far past 6 months, which is why we encourage people to sign up early to get the care and support for both the patient and their families for as long as possible. This benefit is provided through Medicare, and pretty much if you have hospice at home, it's 100% covered. So we have many, many patients that do graduate out of hospice care and return back to us when they or should they need us in the future.
All right, friends, give me a yes in the chat box or in the comment box if you know someone that could benefit from hospice or palliative care. All right, and there is the bell for our brain teaser. I am going to put up the brain teaser on your screen now. And the question is, how is palliative care and hospice care the same? Both relieve suffering, both can be delivered in patients' homes, both improves the quality of life for patients and their families, both creates a plan of care, or all of the above. Again, for those of you watching on Facebook Live, you will not see the polls pop up, but we still want to hear from you. Feel free to put your answers right in the comment box. Everyone is welcome to join in the Fully Engaged Zoom presentation next month. Just email me at llopez@hawaiicarechoices.org and I'll send you the link. Everyone is doing great. We have 100% of you submitted your questions. I'm going to end the poll right there and share the results. Oh my goodness, 100% of you said all of the above. Great job, and thank you for participating in our brain teaser. Back to you,
Oh
Lani.
my gosh, we have such a smart group with us. You folks are awesome. Thank you so much. That is exactly the correct answer. So signs that palliative care is needed. Well, if there's somebody that you know, a loved one, or even maybe yourself, if you notice that you're needing to call the doctor a lot, or you're visiting the hospital, especially now, it's, you know, it's really tough to actually go to the emergency room because it's often filled with, you know, COVID patients. Also dealing with the medications, and oftentimes it's because we have so many medications that it becomes confusing. But another sign is when the acts of daily living become quite challenging, such as, balancing your checkbook, or just driving, going to the grocery store and not remembering why you're there, and or even preparing small meals for yourself, doing light housework such as throwing a load of laundry in there. If those things become difficult, along with other physical things that you are noticing on yourself or loved ones, such as the person seems to be suffering on a more regular basis from pain, swelling in the feet, legs, feeling nauseated, and all of it, always tired, then these could definitely be signs that palliative care is needed.
Right, friends, raise your hand if you know anyone who is visiting or calling their doctors frequently.
Awesome. Thank you for answering. Yeah, we normally don't realize how much we want to reach out to doctors, and we notice now that many people are not, which is why we are often contacted, because people do prefer to get their health care in the convenience and safety of their own home. So we're so glad that you participated in this. Now, when should palliative care begin? Our doctors tell us that it's at time of diagnosis. And many times people will say, well, I don't have really any symptoms. I mean, I just found out yesterday that, I have this illness now, so I'm really just trying to absorb it. Well, we understand that, but we want you to know that the sooner we can come in and help, not only the patient, but the family as well, the better that can be. Also, what happens is, by us providing care early, it really does cut down on the stress of dealing with a serious illness. And oftentimes, because we lift a lot of that stress off the shoulders of both the patient and the family, they not only continue to live a higher quality of life, but they also continue on their journey for a much longer time, where they are still enjoying many aspects of their life because they got the support earlier.
All right, type true or false in the chat or comment box. By signing up early for those with serious illnesses could live longer. Again, please type true or false in that chat or comment box.
Thanks so much, Nona, for that question. We're actually going to be answering it up as we come on soon. Okay, so let's see. Questions. We'll ask for palliative care. So what happens is, our team comes to the house, and when they come there, either the nurse or the social worker, etc., most of the time we'll want to know more things about our patient and their families. And this is just a sampling of some of the questions that we may ask. We really are interested in knowing if the patient really understands about their illness, because we find that it's so critical to receive the right care at the right time. And often, if the patient is really not clear about their illness, they may be taking on some type of treatment that is not actually curing them, but they had no idea. So that's why we often have that conversation. We also want to know who else in the family will be making decisions on the patient's behalf. Is it just the patient, or does the patient insist that they want their daughter to be involved, or their husband to be involved, or a particular caregiver involved? We would want to know that. And the reason that is because every family has a very unique dynamic. And, it could be that the daughter has been taking care of her mom for years, and then all of a sudden her brother flies in from Los Angeles and decides to take over. We really do want to support whatever the patient's wishes are, and we will follow that. Also, we want to know what is important to the family or to the patient, such as, it's okay that our family pet comes in and sleeps on mom's bed. It actually brings mom comfort. That's important to her. or that there are other routines that happen within the family or throughout the week that could help us really minimize any kind of disruption that happens in the family because we are there, such as, the family gets together every Wednesday night, we have bingo night, or, that's when we do our Bible study or whatever. These are the kinds of things that we would want to know. And of course, whatever beliefs or practices the patient finds as a priority, we would want to know that too, because we would always want to honor whatever their wishes are as well.
All right, friends, we want to hear from you again. Is it important for you to understand about your illness? Type yes or no in the chat or the comment box. And I also just want to say thank you so much for sending in your questions. We are going to get to those questions in a few more slides. So just sit tight, we will answer them. Thanks, back to you, Lonnie.
Awesome. Oh, I tell you, the audience is just so interactive. I just love you folks. Go for it. Put it all in there because we're watching. We're seeing your answers come through and we really, really appreciate it. So medication review. This is something that is part of our program, both on our palliative care as well as our hospice care. But on the palliative care side, one of the reasons that it's so important to have our team come to the family home is because oftentimes when we arrive there, we realize that there is so much medication in the home. We've actually come to homes where the entire coffee table is just filled with these pill bottles. And some of it belongs to the deceased ex-husband, others belongs to the adult children that moved out of the home. And then there's a lot of other medications. So how does that happen? It's because a patient may receive medication from their primary care physician and then go to their ologist, whatever, their cardiologist, their pulmonologist, whatever ologist they go to, and get some more medication. And then, maybe there might be an incident and they go to urgent care and they get some more. Whatever the situation, sadly, right now, there isn't a system that will track everybody's medication where it's all on one record. So we end up getting a lot of medication, and some of it actually counteracts each other. And so we find that once we come in the room and we do a medication review, and then we consult with the primary care physician, we're told, yes, you know what? They don't need to take this other medication. They should only be taking this medication. Right off the bat, 5 to 10% of their discomfort or different things that are bothering them immediately just goes to the wayside. So we would go into a house where someone's taking up to 32 different pills a day. After we do the medication review, and we consult with the physician, with their primary care physician, some of them will end up taking 14 different pills going forward. That's still a lot of pills, but believe me, it's a lot less than 32. So medication review is critical as part of the palliative and hospice care program.
Right, friends, and we want to hear your opinion. If you think medication review is important, raise your hand.
Yeah, that's all my smart friends weighing in on that. That's awesome. Thank you. And other palliative care services. So when our team comes, one of the members on the team is the social worker, and he or she is able to connect the family with a lot of resources that are available for free in the community, but maybe the family was unaware of. Some of those might be the food basket, others that might have young children in the home. We could connect them with other places like Boys and Girls Club, etc., and just really try to help with that. Also, there could be a situation where we can apply for additional insurance coverage for the patient as well. Maybe the patient just has Medicare, but indeed could qualify for Medicaid. And so we go ahead and help them process that. And of course, as part of our program, the completion of your advanced healthcare directive is definitely top of the priority. So we make sure that that gets taken care of for any that are in our services.
All right, there is just so much new and wonderful information. If you think these additional services increase the value of palliative care, type yes or no in that chat or comment box.
Yeah, thank you so much. How is palliative and hospice care paid for? Okay, so Nona, this was a question that you asked. So for the most part, palliative care, if you have Medicare, it will cover a portion of it, and then there would be a copay. And the copay could be anywhere from $20 to $40, depending on what coverage that you had at that time. So many people also have a supplemental coverage, whether it's with Medicaid or other, United Healthcare, et cetera. And sometimes that covers most of the copay as well. Definitely for those who have Medicare and Medicaid, there is no copay for palliative care services. And for hospice, anyone that has hospice care at home, you are going to be covered 100%, regardless of what insurance you have, because all of the insurance companies do offer it. Of course, I'd like to share that on the Veterans Administration side, a wonderful benefit has come open for them, and it's Veterans Administration Concurrent Care. For those who are dealing with serious illness, they are now able to get that type of care. So please call us if you have a veteran in your family, or maybe a veteran spouse that needs help because of serious illness. Please contact us directly, because this concurrent care is a fabulous program as well. And then for those who come onto hospice care that may need to go into an inpatient facility or go to a nursing home, private pay is always going to be offered. However, if those people also have Medicaid insurance coverage, room and board will be covered. So just letting you know that having Medicaid insurance is really amazing to get that.
All right, friends, raise your hand if you understand how palliative and hospice care is paid for. Lonnie, I do have a question that came up, if I can ask you really quickly.
Sure.
We have an attendee whose husband is on palliative care, receiving very great support, and wanted to know if it will be expanded to the Hawi area.
At this time, our specific service area is only up to Lapahoehoe Point and all the way across to Ka'u. So North Hawaii Hospice is up there, and I don't believe they're offering palliative care services yet, but I'm hoping that they will do so in the future. At this time, anybody that's outside of our service area, we're unable to provide that service at this time. So why hospice care? So what happens is when we have people that are on palliative care and they are naturally progressing through their illness, once they start to advance, get into a higher stage, maybe stage 4 cancer or something, as it matures, then they may need a higher level of care. And that's when hospice care comes into play. The difference about hospice care is, number one, you definitely need a 6-month life expectancy prognosis from the primary care physician. Number two, you'll no longer be receiving any type of treatment such as radiation, chemotherapy, dialysis, or going through any kind of. The focus really does change onto the quality of life versus the length of life or the quantity of life. And that's really important, because when you're focusing on quality of life, then you're starting to ask yourself, how you're spending the time. Like, are you spending your time with your loved ones? Are you spending your time on doing things that brings you joy? Those kinds of things are so important. And so that's when hospice care really comes in big time. A lot of times people are quite reluctant to sign up for hospice care, and it is scary because people think that they are now facing their own mortality, meaning they're looking at, I'm approaching end of life. I don't want to accept that. So as a result, I'm not going to sign up for hospice care. But I want you to know that hope is redefined with regard to this hospice program, because what happens is it's bring on all the support and care as early as possible, so that every moment that I am on this earth is going to be one that is joyful, one that I'm spending with my loved ones, etc. So what sadly happens is that people don't call us until the last 7 days of their life, unbeknownst to them. But what happens is they wait till they're very, very sick and they call us. We found out that 47% of those that come to us die within 7 days. In fact, they could have a very, very comfortable, year or, 8 months, etc., if they just called us earlier. And oftentimes it's because their doctor has not brought it to their attention that, they could qualify for hospice care, which I was so extremely grateful to my mother's doctor who did tell us that she qualified for hospice care at home, versus my father's doctor, who just never said anything to us. And when his only wish was to pass at home, we had no idea that when he went to the hospital because he couldn't breathe, that was the last time that we would see him at home. So again, if your doctor doesn't bring it up, please go and ask him or her about qualifying for this wonderful care, if that's something that you need. And realize that by signing up for hospice care, you're not giving up hope. No, indeed, you're just redefining your life at that point. And that, my friends, is a beautiful thing.
I agree. So friends, let us know in the chat or the comment box if quality or quantity of life is what you want for your loved ones.
Thank you so much. I just saw a question on whether or not those in palliative care will get a volunteer. And it really depends on if one is needed. Our volunteers are absolutely the bomb. I mean, they are really spectacular people. And although the majority of them always go to serve our hospice patients, we do have palliative care patients that enjoy the company of a trained volunteer as well. So if that's something that you would like, if you have a loved one on our palliative care service, please do not hesitate to bring that up. Thank you for that question. Okay, so it takes a village. The reason I wanted to show you this is that our hospice team is even larger than our palliative care team. We have our nurse practitioners. We also have who also serve as the provider or physician when they come to the homes. We have our social worker. We have our certified nurses aides, and they come to the homes and help groom the patient and just make them feel so wonderful and joyful. Many people just love their certified home health aides because of how they make them feel after their hair is gussied up and they've had their wonderful bath, and they just feel so refreshed and alive again. And then of course we have our grief counselors or our spiritual counselors that will come to speak with the family and also the patient to bring peace to their lives as well. And then of course our wonderful trained volunteers that come to the home as well. I mean, they're definitely our silent heroes, our trained volunteers. And that's why I speak of them so endearingly, because they really do give of themselves, as everybody else on the team. But oftentimes I find that there's a special bond that is created between our trained volunteers and our patients. And oftentimes our patients will move from program to program, provided that their volunteer gets to go with them. And that's the kind of love that is exchanged on this. So again, sign up early for these services, palliative or hospice care, because a lot of comments that I get from families is, I wish I signed up earlier because the family could have used the support. It's one thing for the patient to receive all the care, but boy, we bring in a lot of care and support for the family as well. And most of them don't know that until they sign up. And when they sign up within the last 7 days of life of their loved one, it's really, really quite heartbreaking to realize that they could have come on so much earlier.
I would just like to echo, yes, thank you so much to our wonderful volunteers out there. And some of you are on this call as well. So thank you for joining us. Raise your hand if you think early patient sign up ensures more support and quality of life for all. All right, we got that brain teaser bell again. And the question up on your screen is, early patient sign up ensures more support and quality of life for all. True or false? Again, for those of you watching on Facebook Live, you'll not be able to see the polls pop up, but we want to hear from you and put your answers right into that comment box. I definitely am watching those. Everyone's welcome to join in the fully engaged Zoom presentation next month. Just email me at lopez@hawaiicarechoices.org and I will send you the link. Thank you so much for everyone that has joined in our polls. I'm going to go ahead and right there and share the results. 100% of you said true. Early patient sign up ensures more support and quality of life for all. Thank you so much for participating in the brain teaser. Back to you, Lonnie.
Thank you. I just love you guys. You guys are so smart. I got such a smart group with us. Yeah. So when is it time for hospice care? So like palliative care, there's certain physical changes that happen. Of course, going to the doctor a lot more, or calling the doctor at all times of the night, really noticing that your loved one is losing weight or tends to be extremely off balance. So starts falling a lot more, doesn't really want to eat or drink anything, wants to sleep a lot. I mean, just really wants to sleep most of the day away, and then either wants to stay in bed or it's very difficult for them to get out of a chair. And you'll notice too, their skin is naturally thinning, but also there's infections that tend to break out throughout the body. And so that is definitely signs that hospice care is needed.
Friends, now we would like to share a personal story from patient caregivers.
Every single person in Kupu Care was like an angel. They were right on. They helped me. And then when it got really bad, and so the doctor finally acquiesced. But the doctors, I think, take too long to plug people into the home health care they need. He got hospice finally, and he was with them almost 2 weeks, and then he passed away. But I could have used them way before. And people need to be informed, by the doctors about Kupu Care so they can get them plugged in to the help they need. Otherwise, they're going to be in the situation I was in, which was pretty intense for quite some time. Thank God for Kupu Care, and all the people in hospice were angels. They were wonderful, beautiful people, beautiful.
Well, one of the reasons why we went to Kupu Care was that my husband had found out that his illness was probably going to be progressive and not curable, so he was a little anxious, and so was I. During that time, after he was diagnosed, his idea was spend as much time with the grandchildren so that they would be able to, I guess, remember. He had spent a lot of time with the community, and so he wanted to spend more time with family. And I think Kupu Care allowed him to do that. As far as quality of life goes, I think it was exactly what my husband Barry wanted.
Thank you so much, Tish, for sharing that with us. That really does bring it just directly home to everybody that is thinking, as a caregiver, what could they do more? And oftentimes when I speak to caregivers, they have a sense of guilt on, I'm supposed to be taking care of my loved one. I'm not supposed to be getting help because that's how culturally I was raised. However, I tell you, if you want the best care, then you want the experts to come in and help you so that you could be a better wife, a better son, a better daughter, a better granddaughter. So let us come in and help you to do that work. Anyway, for those of you who do not have an advanced healthcare directive, I want you to know that whether you're, especially if you're not on any one of our programs, this is the ultimate gift to give to your loved one. And it's free if you do it this way that I'm going to show you. Anyway, the difference of an advanced healthcare directive versus a PULSE, which I'm going to explain to you on the next slide as well, is that the advanced healthcare directive, it provides the voice of direction. So it gives your loved one or agent, whomever it is that you assign, to speak on your behalf, but to provide direction to the healthcare providers that will be caring for you should something happen. So in other words, like if I got into a car accident yesterday and I was rushed up to Hilo Medical Center and my advanced healthcare directive said that I did not want CPR, or that I did want CPR, or that I want all the measures to keep me alive, and my agent is contacted and is actually able to give voice to whatever my direction was, that is what is so important. What is the normal crisis is that something horrible happens, the loved ones rush up to the hospital and have no idea what the direction was. And so I see it time again where they're fighting at the emergency room on, no, mom wouldn't want that, or yes, mom wanted that, or no. It's just really, really the amount of peace that you can bring your family by having an advanced healthcare directive. If you are 18 years or older, please get an advanced healthcare directive if you do not have one.
And friends, let us know in the chat box if you would like, let us know, yes or no, do you have an advanced healthcare directive?
And this is how you get it. Okay, so if you're not on one of our programs, please contact these amazing people to get one done for free. I mean, it's really amazing. And for those of you who have a smartphone, you could just even put it on your camera and just go to this QR code too. It'll take you directly online to this registration right here. Or you could call my great friends, Amy and Rosemary, who are amazing to answer your questions and sign up. So, they are doing these both in person and over Zoom, so you can see which one you feel most comfortable with. So go ahead and sign up. I mean, the information that they give, and that the fact that you will leave out of that session with a completed advanced healthcare directive is just amazing. So please get one, because that by far is one of the greatest gifts you could ever give to your loved ones. All
right, friends, I'm going to go ahead and put that information into the chat box now. feel free to copy and paste it, or again, like Lonnie said, take a picture of it, of this slide on your phone, or scan the QR code. Thanks. Back to you, Lonnie.
So some people get confused with this POST. A POST means a physician order of life-sustaining treatment. That's what POST means. It normally is a green sheet, just like that one that I have on here. So the difference with this is the POST is an order, where the Advanced Healthcare Directive is a direction. It's a direction that you're giving to your agent. Now, an order, a physician's order, carries weight. So people that would fill out a POST is not everyone that's 18. No, in fact, the population is much smaller on who would actually need a POST. Normally, it's someone that is typically seriously ill. They could be older, but not necessarily, but they're definitely very frail. So, so let's just say for Tish is young, she still has a young child, etc. She would not fill out a POST because she doesn't have a serious illness. And if something unfortunate were to happen, she would actually want steps to keep her alive taken. Now, for somebody that's say 90 years old and has a serious heart condition, or maybe it also has cancer, they may want to fill out a POST. In fact, their doctor probably will require that. And why that happens is because this green paper goes on the refrigerator or wherever is an obvious place in a home, so that when the emergency medical team shows up to take them to the hospital for whatever emergency reason, they will know that the POST says that this person either wants CPR or not. And let me explain to you why. Those who are frail and older, they could risk having their ribs broken during the process of CPR. And it's because they are frail and older. And so, you know, if that's not going to help sustain their life, by all means, they won't want that to be done. So that's why it's important. These two pieces of paper, the Advanced Healthcare Directive and the POST, are very different pieces of paper. So one is to give voice to your agent who would be in the room should something unfortunate happen to you and you're over the age of 18. A POST is actually a physician's order. So people are going to follow that green paper.
All right, friends, we want to hear from you. Do you need a POST? Type yes or no in the chat box now.
Yay, awesome. I see that people are weighing in and they understand now by saying no, they don't need a POST. So that's awesome. That means you actually understood what I explained to you. Yes, it's very, very rare that people will need a POST.
Wonderful.
Let's go on to the brain teaser.
I mean, everyone is just so smart today. And we have a question up on your screen. Where do I get my free Advanced Healthcare Directive completed or updated? Register online at communityfirst.org, communityfirsthawaii.org. Call Amy Hamane or Rosemary Burnett, or all of the above. Lonnie, a question did come in, and I'd just like to quickly ask you, do you provide services on the island of Oahu?
No, that would be outside of our service area. However, Community First is more than welcoming anyone from any island to join them over Zoom to help them get their Advanced Healthcare Directive done. So in this particular case, yes, we could certainly provide services that far.
Wonderful. I'm going to go ahead and end the poll right there and share our results. 100% of you said all of the above. Thank you so much for participating in our brain teasers. Back to you, Lonnie.
Thank you, everyone. And for those of you who may or may not know, we have an inpatient facility. It is state of the art. I mean, it is the Mauna Lani of hospice, and it is located right in the middle of town on Kapi'olani Street. And there is Tish and her lovely daughter at the entrance of Pohai Malama. People go there when their symptoms, while they're on hospice care at home, might be out of control. Then they go to our inpatient facility here, Pohai Malama. And once we stabilize and manage their symptoms, then we send them home. Although I'd have to say that the majority of people that come to our inpatient facility here normally pass here. This is not a long-term facility, long-term care facility at all. People come here for transitional care, meaning the average stay here is about 14 days, and then they return home or they pass here. And so room and board is covered by Medicaid, if people have that coverage, and or private pay.
Wonderful. It is a very beautiful facility, and we'd all like to share with you this beautiful short virtual tour of Pohai Malama.
Welcome to Hawaii Care Choices Pohai Malama, a Harry and Jeanette Weinberg Care Center. This is a state-of-the-art short-term care facility designed to feel like the most beautiful home you've ever been in. A spacious living room to gather your entire ohana together. The meditation room provides a beautiful space overlooking the gardens to find solace and quiet contemplation. Nothing feels more like home than gathering the family for dinner around the TV, which you can do in the family room while the keiki play in the room next door. Each suite is designed for maximum patient and visitor comfort, with sleeping areas for guests, private bathroom facilities, and each room even comes with its own private lanai overlooking the lawn and gardens. When you or your loved one are in our care and you need some extra care, there's no place like Pohai Malama. For more information, call us at 808-969-1733 or visit us online at hawaiicarechoices.org.
Thank you, everyone. It's just such a beautiful place. And for those of you who've actually been in it, you know exactly what I'm talking about. But we just wanted to give you a really short glimpse of how beautiful, truly royal it is at Pohai Malama. And on this map here, I just wanted to show you the areas of where we service. So all of the area that's colored, you know, gray, dark blue, light blue, dark gray, that's all the areas that we cover on this very, very large island. So if there's anybody that's outside of our service area, such as Hamakua or Kohala, then North Hawaii Hospice provides service to them. And then Kona Hospice provides services for everybody on the Kona area all the way down to Ocean View. So that's how we are separated. And then, of course, our mission here to improve the lives of those we touch by offering support, guidance, and compassionate care of body, mind, and spirit. This is our mission that we do every day, every week, every month, every year. And we hope that you will give us both the honor and privilege of helping you with any of your loved ones as well.
Thank you so much, Lonnie. I'm going to go ahead and turn on my video there. Thank you so much for everyone who has joined in this morning for our new and improved Healthcare Insider. If you have any specific questions about you or your loved one situation, please connect with us by calling the number on your screen. We have a very helpful team that will be happy to answer any of your questions. Very special mahalo to our guest speaker, Lieutenant Governor Josh Green, for his valuable time, his perspective, and his updates for today in today's Healthcare Insider. And also, Lonnie, thank you so much for telling us all about the updates and our services that Hawaii Care Choices provides. For those of you joining us on Zoom, there'll be a quick survey that will pop up on your screen. Please make the selection that you think is best possible for all 6 questions, and then click the submit button below. For those of you joining on Facebook, please send us your thumbs up or your hearts if you enjoyed this presentation, and send a mahalo or a thank you to our guest. We'd love to get your feedback on our presentation today, because your input will allow us to gain a better understanding of how we can best serve our community with presentations like these in the future. Lonnie, while they are doing their surveys, I had some other questions that came in for you, if you don't mind me asking.
Sure, you can go ahead and turn on my my camera now, since we are on to the final screen here.
Got you. I will get this right on there.
Okay, great.
There we go.
Yay. I'm so glad to be back with everybody on camera again. Yes, so by all means, please ask me whatever question has come in.
Right. I think this goes back to the video that we watched. Why don't doctors tell their patients how long they have to live?
Oh my God, that's such a wonderful question. Okay, so my short answer would be because doctors fear being incorrect with their prognosis, with their prediction. So that's one of the reasons. So they don't want to tell you that you have 6 months to live and then in fact you live 2 years. I don't know why that would be a problem, but you know, I think that would be wonderful if people lived longer than their prediction, but that's one of them. Another fear is that they don't want to, or they think that it will ruin their patient-doctor relationship by providing bad news like that. And so that's why they don't want to tell them. And then finally, they don't want their patients to lose hope that that the news will make them depressed. And so they don't want to be the bearer of bad news, so they just don't tell them. In surveys and studies done across the nation, it has been discovered that people are not affected that way. In fact, 71% of people surveyed preferred to know what their prognosis was. And so, and then the rest of the people were not affected either way, you know, when they were told the information. So this is just something that doctors personally have within them, that they don't want to tell people the actual truth of their illness. Now, we find though that that is evolving, and that the doctors who are now coming out of medical school are a lot more open and a lot more direct with regard to being really transparent and upfront with their patients. You know, I guess it was old school, the idea of, you know, we don't want to upset our patients, we don't want to give them bad news. But now it's more about, I want you to understand about your illness, because together we're going to fight it. And that's more where it is now. I mean, hope is bigger than it ever has been in decades. And so I implore everyone that's on the presentation here that if you think that there's a loved one that could use the help and the doctor is not saying anything, by all means, please bring it up, because I have seen the difference. I have experienced the difference of having one parent in hospice care and the other parent not, and largely because one parent had a doctor that brought it up and another parent that never did. So anyway, great question, Tish. Thank you so much.
Well, I thank you, Lonnie, for answering it. Looks like we have a few more taking the taking the survey still. So I have one more question, and it'll be our last before we close. But what kind of allergies? Yep.
I wanted to add one comment. So with regard to your question about why don't doctors just ask? Oftentimes, if you ask yourself a question of, would you be surprised if your dad, if your mom, if your grandma was no longer with us in 6 months or a year from now, and your answer is no, then it's definitely time to call the doctor. So we find that when we ask families that, would you be surprised if your loved one was no longer with us in the next 6 months to a year? And if they said no, then we know that it's time for us to take action on that. And really, we just use that question as an opener to provide the right care at the right time. And that part is so paramount to all of us on all of the programs and on all of the teams as well. So again, that question, would you be surprised if your loved one was no longer with us 6 months to a year? And if your answer is no, then boy, give us a call on that number that's on your screen.
Thank you so much, Lonnie. I do have one more question. I promise this will be the last. Do we have to wait for a doctor's referral to connect with Hawaii Care Choices?
No. Okay, so you call us and we'll call the doctor. So ultimately, a doctor's order is required for us to actually contact you and provide services, but you don't have to wait for the doctor to be the first one to call us in. I think in the last few years, it has been amazing, the evolution of people taking responsibility for their own healthcare. I mean, it has been revolutionary because, initially, I think 6 years ago, we would say maybe 15% of people would contact us and say, I think I need services. But now as high as 65 to 70% contact us directly. So that's really incredible because now we're all on the same team together and we're all trying to strive for the best possible healthcare at the right time for every person. So anyway, please call us and we'll circle back and contact the doctor for you to make it easier.
Wonderful, Lonnie. Thank you so much for answering all those questions. And thank you everyone who has been with us on this Healthcare Insider. If you feel you've benefited from this presentation, please let your friends and family know that they're welcome to join us on the 10th of every month at 10 a.m. Just RSVP to myself for the Zoom link or tune in on Facebook Live. Again, that's the 10th of every month at 10 o'clock. Mahalo again for joining us and see you next month right here for her Healthcare Insider. Aloha.
Aloha, everyone. Mahalo for your comments. Really appreciate you all. Thank you so much. Aloha. Have a great rest of your day.